Justin Timberlake opens up about his Lyme disease struggle. In a candid Instagram post concluding his Forget Tomorrow World Tour on July 30, 2025, 44-year-old Justin Timberlake revealed that he had been battling Lyme disease during the tour. He described the condition as relentlessly debilitating, both mentally and physically, sharing his personal journey and aiming to raise awareness about the illness. Timberlake said he was initially shocked by the diagnosis but relieved to finally understand the nerve pain, extreme fatigue, and bouts of sickness that had impacted his performances, especially in later shows. Despite criticism and cancelled shows due to bronchitis, laryngitis, and other ailments, he chose to persevere, citing the joy of performing as outweighing his physical distress. In his statement, Timberlake recalled, "I've been battling some health issues and was diagnosed with Lyme disease. If you've experienced this disease or know someone who has, then you're aware. Living with this can be relentlessly debilitating." He acknowledged being raised to keep his struggles private but now feels compelled to share in hopes of connecting with others and combating misinterpretations of his performance choices. What is Lyme disease and how does it present? Lyme disease, Lyme borreliosis, is a bacterial infection caused by Borrelia species, transmitted via tick bites. It's most prevalent in parts of North America and Europe, and annual cases in the US may reach roughly 476,000, or closer to 200,000 in Europe. Common symptoms. A bullseye rash, erythema migrans, appears a week or more after a tick bite in around 70 to 80% of cases. Flu-like signs, fever, headache, fatigue, swollen glands, muscle, joint aches. If untreated, symptoms can escalate to neurological issues, facial palsy, memory problems, tingling, joint problems like arthritis, heart irregularities, or lymphocyte and nerve involvement. Timberlake spoke of nerve pain, intense fatigue, and malaise that aligned with these more advanced symptoms. Left untreated, Lyme may progress to long-term complications affecting joints, the nervous system, or the heart, reinforcing the importance of early diagnosis and treatment. Diagnosis and treatment. Diagnosis typically relies on symptom history, possible tick exposure, and blood tests when appropriate. Notably, presence of a bullseye rash may be enough for clinical diagnosis without needing lab tests. Treatment usually involves antibiotics such as doxycycline or amoxicillin isoflurane for children or pregnant individuals, and anti-inflammatory medications to manage symptoms. Most patients improve with prompt therapy, though some report lingering symptoms even after treatment. Why Timberlake's disclosure matters. Timberlake joins a growing list of celebrities, including Justin Bieber, Avril Lavigne, Bella Hadid, Yolanda Hadid, Shania Twain, and Ben Stiller, who have publicly battled Lyme disease. Their openness helps reduce stigma and raise understanding of this often invisible illness. By sharing his diagnosis, Timberlake hopes to provide context to criticisms about his stage performance, build connection and empathy for others grappling with chronic or obscure health conditions, encourage greater awareness and early action for Lyme disease. Public health tips, prevention and awareness. Health professionals emphasize that Lyme disease cannot be caught from any tick bite, only those involving infected ticks in endemic areas. In the UK, cases are most common in regions like the Scottish Highlands, North York Moors, New Forest, and Lake District. To lower risk, experts recommend wearing long sleeves, trousers, and using insect repellents, DEET, permethrin. Avoiding tall grass or woody vegetation. Doing thorough tick checks after outdoor activity. Removing attached ticks promptly with fine-tip tweezers, cleaning the site, and monitoring for symptoms. If you experience a rash, flu-like symptoms, or joint pain following a potential tick bite, seeking medical advice as soon as possible is vital. Early treatment generally yields excellent outcomes. By going public with his diagnosis, Justin Timberlake hopes to transform personal adversity into a message of awareness and solidarity. His experience underscores how Lyme disease can remain hidden, debilitating, and misunderstood, even for high-profile individuals. Takeaway: recognize the symptoms, act fast, and advocate transparency for yourself and others.